Okay, so I'll be starting my talk. So a very good afternoon, everyone, and welcome to this session today on non-surgical face contouring and anti-aging, a combination approach. As we all know that our country and in fact the world is going through some tough times of lockdown because of the COVID virus. So let's make use of this time in our homes and learn something about facial contouring and anti-aging and some of the basic concepts basically. So my aim would be to give everybody a small idea about the various anti-aging technologies, especially with special reference to high intensity focus ultrasound and the radio frequency devices. So the talk today would be actually divided into a few sections, which I'll just enumerate. We'll be discussing something about the history, about the anatomy, about the various devices, how do they work, the basic concepts involved, the clinical experiences and the combination approach, and some minor discussion at the end. So I would be most welcoming all of your questions at the end of the session in the chat section, and we can discuss. And at the end of the talk, I'd also be sharing my email, so you can actually email to me any further queries if in case anyone has, and we can learn from each other. So let's start this session. So all of these things started with the desire to look young. So anti-aging process, it actually started, the history of the device of the anti-aging started with the introduction of ablative lasers like carbon dioxide laser. They used to break the epidermis, deliver the energy into the dermis, and cause collagen rearrangements. However, they had some side effects of erythema, hyperpigmentation, inflammation, and then were introduced the non-ablative lasers, like for example, the erbium YAG lasers. They used to stimulate the dermis directly without damaging the epidermis. However, the energy was not able to reach the dermis. Why? Because of laser diffraction, because of absorption differences in various parts of the skin, and because of scattering. So there was always a reckoning. We needed devices which could ensure epidermal safety, control of depth, no or least downtime, and which was also at the same time effective. So then were introduced the devices like radio frequency and focus ultrasound devices. So a brief overview of today's talk would be, we'll be discussing in short something very specific to the devices, something about the skin structure and anatomy, device and indications, fractional microneedling, non-invasive radio frequency, HIFU, and the various combinations that we do for the anti-aging process. So all of us know about the skin structure and the anatomy. So this is a basic skin structure which we very well know. It comprises of the epidermis part, the dermal part, the deep dermal part, the subcutaneous part, the SMAS layer, and the muscle layer. This is the layer basically SMAS, the fibromuscular layer, which is actually we need to focus on majorly. So this is the SMAS layer beneath the dermis and the subcutaneous tissue and above the muscular compartment. So what happens when we start to age, both clinically as well as histologically, we see thinning of the skin. We see the epidermis getting thinned out, the dermis getting thinned out. Why? Primarily because of elastin and collagen degeneration, which happens as we age. There's also weakening of fascia, the retaining ligaments, and the SMAS ligament, which we have just enumerated. There's also resorption of the fat pad, there's weakening of the muscles, there's bones resorption. So there are a lot of things happening underneath the skin, especially in context of the face as we start to age. So SMAS is the layer that we had just discussed. It's a superficial muscular aponeurotic system, which extends from superiorly from zygomatic arch and goes down till the platysmal muscles. It is at a depth of about 4 to 4.5 millimeters. So along with the fibromuscular layers, we also have a loosening of the fatty tissue often. These are the various, left side we see a representation of the various fat compartments of the body, and this sagging because of the degeneration and the sagging of the skin because of the sagging of the fatty compartment of the skin. So this picture actually discusses the various aspects of aging, facial sagging versus facial deflation. The picture A, the patient has a problem with sagging, especially in the lower third of the face and the neck. In the picture B, the patient has mainly the deflation problem, which is very common in the males. And section C shows the marked structural changes in the skin quality. So we actually have to combine various modalities to give the desired results that the patient needs to have. So we have to assess and analyze ourselves what we need to do. We need to discuss what does the patient wants, and then eventually form a plan which will be actually beneficial to both the patients as well as the treating physician. So there are various methods that we can do for different kinds of presentations. It can be filler, it can be pediothreads, it can be neuromodulator, it can be injection lipolysis, It can be radiofrequency, it can be high intensity focused ultrasound, it can be laser assisted lipolysis or suction. So this particular talk will be discussing majorly about radiofrequency and high intensity focused ultrasound. So let's go ahead with the device and indication. So a disclaimer, general disclaimer, that I have used primarily the device called as Ultracel by the GCS company. And although we would be actually discussing in general, the concept basically will be the same in various kinds of devices that are available in the market. It could be radiofrequency, high intensity focused ultrasound. So whether you use this device or not, you will be able to understand the basic concepts of anti-aging by these two technologies, which is radiofrequency and the high intensity focused ultrasound. So the device actually comprises of three major handpieces, which is the microneedling RF, the grid RF, and the high intensity focused ultrasound. I'll be discussing each of them in detail, so we'll be understanding that eventually. So my idea of using the device is that I can treat the various layers of the skin. We can treat the upper epidermal part by the grid RF, we can treat the mid-dermal part by the fractional microneedling, we can treat the lower part of the SMAS layer or the deeper parts by the ultrasound devices. So this is an all-layer therapy, as we see in the figure on the right side. We can do grid RF, we can do microneedling RF, and we can do high. So various different handpieces have got different indications. So the fractional microneedling part will actually help in the large pore reduction, acne scars rejuvenation. The grid RF part will help in tightening and fine lines. And the third part, which actually is HIFU, will help us in facial lifting and face contouring. So we'll discuss each of the concepts of each one of them in detail so that we understand at the end of the talk, where do we fit which technology. So let's talk about radiofrequency. So there are multiple devices which are available by radiofrequency, by the name of radiofrequency. It can be monopolar radiofrequency, bipolar radiofrequency with vacuum, and unipolar and bipolar radiofrequency and ultrasound technologies. So what is basically radiofrequency? And we'll be discussing the next slide. Now radiofrequency can be monopolar, bipolar, or unipolar. So there's a very small difference between monopolar and bipolar and unipolar. In monopolar, basically we have the device that produces the energy and we have a ground plate. So basically the depth of the radiofrequency increases because of using a ground plate. Bipolar means that the handpiece itself has got plus and minus charges. So the current only flows from the one of the electrode to the other. Unipolar RF is something like monopolar. However, it does not have the ground plate. Basically, ground plate is also incorporated into the handpiece itself. Then there's a fractional radiofrequency. In fractional radiofrequency, we can either use electrode RF, which is a sublative RF, so means the needle probe goes inside the skin. It is basically a part of the ablative RF. And then we have the microneedling radiofrequency, which can have various kinds of needles. It could be insulated needles, it could be non-insulated needles. As per the studies, some of the studies that I've gone through, then insulated needle is considered to be much better because of lesser downtime. So we'll discuss this eventually in the slide. So what does actually radiofrequency do? So radiofrequency actually comprises of electromagnetic radiation, which because of the rotary movement of water molecules in the closed tissue, when it enters into the closed tissue, especially the dermal part and the epidermal part, it produces thermal energy by friction. So this focal thermal energy causes damage to the collagen in the dermis, and then eventually it induces the collagen remodeling. So let's talk about ablative versus non-ablative. So we'll first focus on the ablative radiofrequency. As we had discussed in the slide before, ablative radiofrequency is either sublative or in the form of microneedling RF. So we'll be discussing ablative radiofrequency in the form of microneedling. So this is the device, is the handpiece. So it comprises, this is basically, you can see 49 microneedles placed equally apart. And so this is fractional microneedling RF technology. There is penetration by the insulated needles. There is no damage to the epidermis. Tiny columns are created at the end of the microneedle. So at the end of the microneedles, you have the radio frequency which is passed into the skin, and growth factors are released eventually because of the heat, leading to natural recovery. Another important thing to understand is that we can actually measure the depth. We can actually control the depth of the needle that goes inside the skin. It can be either 0.5 millimeter, it can be 0.8 millimeter, it can be 1.5 or 2 millimeter. There are a lot of devices which can actually go till 2.5 or 3 millimeters. However, it doesn't make a major difference per se in the results. So it's a powerful device. So what are the indications? As we already discussed, it is indicated in post-acne or surgical scars, chickenpox scars, stretch marks, open pores, fine lines, wrinkles. It is also important to understand that where we should not be doing these procedures. We should not be doing this in patients who have active infection. It could be viral or bacterial, or who have eczema, or in pregnancy, in fillers, injection within the last 6 months. If fillers was done, try to give it a gap of about 6 months to 1 year time to be on the safer side. And patients with pacemakers and metal implants, patients who have got photodermatosis, and patients maybe also have gone some chemical peels and high dosage of retinoids also should be ideally avoided. Just a diagrammatic representation of the same. The needles goes inside the skin. It actually causes ablative wound healing process. And the downtime basically in Asian and Indian kind of skin is basically hardly 2 to 3 days. So a small pictorial representation. I would not be able to show you the live videos because of the lockdown process, but a small video which I had made in the past, I would just like to share it with you. So we apply a numbing cream half an hour before we do the procedure because it can be otherwise painful because of microneedles penetrating. And this is how we run the device on the surface of skin. And this is how we, you can see the device has various depth controls out here. So the device goes underneath the skin, it causes the ablation process and the tissue remodeling. So this is how the device actually works. So let's share some of the results with the device. Now this particular case had got very superficial scars and some amount of moderate kind of scars, some ice-pick scars as well. So I chose a 2 mm depth needle, and there are various levels. I choose the level 6 because the patient had very good tolerance, he wanted faster results. So in 3 sittings, this is the result that I was able to give him. So I always choose 2 depths, 2 different level of depths in this particular patient. One was a 2 mm depth at level 6 and 0.8 mm depth in level 3, and 3 sittings at the interval of 6 weeks gave me very good results. So if you see this area, the scars have very significantly improved. If you also see another scar in the temporal area, you see that it has also actually very nicely improved. So another patient who had come to me with open pores and ice-pick scars and post-chickenpox scars and post-traumatic scars, and this just at the interval of 6 weeks, just 2 sittings with similar energies, I was able to give her a good amount of improvement, wherein there was a reduction in the open pores, there's improvement of the chickenpox scars in 2 sittings, and I've advised her 2 more sittings for best results. Another patient with post-acne scars, another patient with severe acne scars. However, in this patient, I had also combined a microneedling radiofrequency with platelet-rich plasma infusion, and the sittings were done at the interval of about 6 weeks. As you can see that in every sitting, I chose 3 particular depths. One was 2 mm depth at 6 level, 1.5 mm depth at 4 level, and 0.8 mm depth at 3 level. So we can actually play with the depth wherein we can actually go and treat the patient. Another patient, again treated with 3 depth levels, and in each of the settings, PRP was combined with the microneedling radiofrequency. So PRP works very well. We'll be discussing this eventually at the end of the talk about the combination therapies. So now let's talk about non-ablative radiofrequency. So non-ablative radiofrequency in this particular device is an FDA-approved modality. It's a 4th generation radiofrequency. It acts on the upper dermis and is a grid pattern that protects the epidermis. So epidermis is actually not damaged, and instant tightening in 2 weeks time. And there is actually absolutely no downtime except a little bit of erythema that actually happens. So basically, in this, 2-step mechanism happens for the tightening. As we can see on the right side, there is, if you see this yellow section, when the probe is put here and we treat, there's actually a bulk heating that happens of this area. So there's an immediate collagen contraction that you're able to see. There's dermal contraction for tightening, as well as because of the tightening of the fibrous septae which are present in the 3-dimensional area into the dermal section, there is actually a 3-dimensional contraction also that happens. So this is an immediate effect that you actually see. However, you have to counsel the patient that this immediate effect is not the absolute and the final effect. You will be seeing the effect from the next 1 to 2 to 3 months time actually, because what happens, there's a secondary delayed wound healing process also that will happen, wherein there will be collagen, new collagen deposition, new ground substance deposition, and remodeling and tightening of the tissue. So this is basically the handpiece of the device. It has got 15 by 15 and 7 by 7 mm. 2 different kinds of hand pieces. This is for the face and the cheek area, forehead, and this is for the around the peri-orbital area. So it's a powerful 6 MHz device. Now, another very important concept that we need to understand here is the concept of time impedance of the tissue. So basically, there are 2 concepts that we need to understand here. One is the frequency of the device. Right, so frequency can vary from 1 MHz to 300 MHz. So frequency, basically the frequency and the depth of penetration are inversely related. So a device which has 1 MHz can actually penetrate deeper than the device which has about 300 MHz. So frequency is important. Another important concept to understand here is the tissue resistance and the time concept. So the energy that we are putting into the skin is actually dependent on 2 times the current multiplied by resistance multiplied by time. So what is resistance actually here? Resistance is the impedance or the amount of resistance that the energy has to face while it is going into the skin. Now this resistance uh, is actually different for different parts of the body. For forehead the resistance is less, for cheeks the resistance is more. So the resistance can be different in different parts of the body, and the resistance can be actually different for the same parts of body in different individuals. What I mean to say is cheek area can have different resistance in different individuals. So we have to understand the concept of time, the duration for which we are giving the treatment, as well as the temperature monitoring, which is very important. So the surface temperature we must keep it to be around 40 to 42 degrees centigrade, because with this temperature on the surface we would be able to heat the underlying tissue to about 60 degrees centigrade, which will cause an optimal shrinkage of the tissue. So I had to take a video just to demonstrate the method by which the process is done. So we first cleanse the area. Once the whole area is cleansed, eventually we apply a coupling fluid or a gel all over the face, and then the grid radio frequency process is done in 2 methods. One is known as the preheating method, in which we continuously run the probe all over the surface of the skin. This causes redness, this increases the vascularity, and very important concept again, the same formula, if we increase the vascularity of the area, we would be able to increase the penetration. We will be able to reduce the resistance of the tissue, and the energy will be able to penetrate faster. So in the second step, we do a radio frequency in the grid pattern now. So we actually get a paper with grid patterns, we actually apply it on the skin, and then we apply the energy individually in the grid patterns. So this is how the process is done. This is just a study to see the effect in the submental fat, the reduction in the submental fat in short term versus long term, and the improvement was found to be significantly higher. Another important concept to understand here is the radio frequencies not only causes collagen remodeling, it also is actually sidal to the adipocytes. It can actually cause the destruction of the adipocytes if it is heated to the right temperature. It is said that in about 40 to 42 degrees centigrade temperature, you can cause delayed apoptosis of the adipocytes. However, if you increase the temperature to about 45 degrees centigrade, the apoptosis can actually be much more faster. Another concept that we need to understand here is the surface temperature as well as the temperature of the dermis. So if the surface temperature is about 42 degrees centigrade, we would be able to achieve the dermal temperature to about 60 degrees centigrade. If the surface temperature is about 45 to 50, we will be able to achieve the dermal temperature to about 70-80 degrees centigrade, which is actually not advisable. So it is to be in the safer zone, the surface temperature should be in the range of 40 to 45 maximum. It's based on your clinical judgment. And by this temperature, you should be able to achieve a temperature in the dermal area of about 60 degrees centigrade. Now, if you're able to do this for an interval of 15-20 minutes, about 30 minutes, we should be able to achieve collagen denaturation of about 30 to 40% of collagen in the skin, which will be able to give you very significant clinical improvements. But the end of it it's totally dependent on your clinical judgment. Now let's come to the major section, which is high intensity focus ultrasound. We will be discussing this section in detail because this is something which I was asked to discuss, considering very less amount of knowledge among us among the particular topic. So let's discuss, let us share our views and learn from each other. So this is basically the handpiece. So what is basically ultrasound? How does ultrasound help in lifting or rejuvenating the skin? So ultrasound basically is a wave that is higher frequency than 18 kilohertz. So what is 18 kilohertz? Basically, we understand that the audible range is for the human ear ranges from 20 hertz to 18,000 kilohertz. So any frequency which is higher than 18,000 kilohertz, which the human ear is not able to hear, is basically an ultrasound. So ultrasound is basically used for diagnostic devices in the currently, as well as in the case of uterine and breast cancers as well. So what happens is, because we use a transducer which produces ultrasounds, and it actually penetrates into the skin, it focuses into a focal point and causes a coagulation necrosis on that focal point. This focal point depends on the type of transducer that is there. So it can has various, the transducer, the upper part, transducer of the device, the handpiece can has various penetration depth. It can be 1.5 millimeters, it can be 3 millimeters, it can be 4.5 millimeters. I'll be showing the transducers in the next slide, so you'll be able to understand it better. So HIFU produces powerful energy to make coagulative necrosis and by sparing the other areas, especially the epidermis and the upper dermal part. It's basically a harmless procedure, and there's no bleeding, no infection, no penetration, totally non-invasive and safe treatment. So basically, high intensity focus ultrasound, it induces vibration of the target tissue into the molecule, thereby the heat is generated because of the friction, and then it causes denaturation. So this is a diagrammatic representation. It is the ultrasound is emitted at 4.5 mm depth with fractional shape. I'll be showing you a video so that you can better understand how does it happen. It makes a thermal damage to the deeper layers with the fascia, SMAS layer, dermal layer, dermis, and there's gradual tightening that happens for several months eventually. So what are its indications? It can be for basically V-line, double chin, face lifting, jowl lifting, wrinkle reduction, brow line, nasal folds, and the pore treatment. So there are three kinds of handpieces. The dermal part, for treatment of the dermal part, we have 1.5 millimeter handpiece, fat layer is 3 millimeter, and SMAS layer is 4.5 millimeter. So 4.5 one is good for double chin with a lot of fat, the jowl line reshaping and foreorbital fat. 3 mm is for nasolabial compartment, periorbital, and 1.5 is for neck and large pore reduction. So this is very important. I've just tried to share this one so that you understand the concept as to how the energy penetrates. So it induces focus ultrasound with, as you can see, we can select depth. This particular is for the 4.5 mm depth. So with the C cartridge, which is the 4.5 mm depth, it emits the high intensity focus ultrasound, which goes into the SMAS layer and thereby causes coagulation into the deeper layers. So it's also known as microfocus ultrasound because it induces less than sub-millimeter amount of areas of necrosis, which helps in regeneration eventually and the lifting of the tissue. Now they are using the 3 mm, the cartridge number B, which is the 3 mm. So you can see the tissue being fired. So this is XY axis. I'll show you in the other axis also how does it happen. So 3 mm, we are able to induce coagulative necrosis in the 3 mm zone and the 4.9 mm zone, and this is how it causes the remodeling eventually. So eventually the remodeling happens. This is just for your demonstration. Let's go to the next slide. So this was a histological slide which showed the 3 mm depth cartilage, which shows coagulation necrosis not only in the dermal area but also into the fibrous tissue, which is the in between the adipocytes. Now, because the fibrous tissue is in the 3-dimensional state, it can actually induce a 3-dimensional contraction as well. Another slide histologically to show the 4 mm depth cartilage, which is extending till the SMAS layer. So first of all, before we start the treatment, we have to do a mapping of the area. So there are certain areas which we should not be treating, especially just on the nasolabial fold and the mandibular area because of the presence of mandibular nerve division of the facial nerve. So in the thicker areas, we can use 4 millimeter. In the thinner, finer areas, 3 millimeters. Now this is all totally customizable. You have to see and analyze your patient. If the patient has very thin skin, you can actually avoid 4.5 millimeter. You can just go for the 3 millimeter also, because thin skin, 3 millimeter will be sufficient enough to reach the SMAS layer. After all, the major indication and the target in getting the HIFU treatment is to reach the SMAS layer and into the lower dermal layer. So you might not need to use the 4.5 mm in those kind of patients, and use 4.5. You can actually customize in certain areas which are much thicker and they have much more amount of fat or they have thicker skin. 4.5 mm can be used. So just a diagrammatic representation for you that you have to avoid this area, the lower jowl areas, as well as in the just in front of the tracheal cartilage. These areas and the thyroid, so these areas have to be avoided. We actually, before we do, we actually make a mapping of the area. We outline the area which we do not have to treat, and we outline the area that we have to treat. So these are the various lines. So each cartilage produces about 8 or 10 focal points in a straight line, which I'll show you eventually in the phantom test. How does it work? So we try to put about 400 to 500 total lines in the face to be able to give good results. So this is how we actually formulate a pattern. A small video which I had taken online which shows how it is eventually done. Here you can see the energy is actually fired on the specific area. This is how the treatment is done, and the patient is relatively quite comfortable in the whole process. So this is how we repeat on the full face. So some of the results, basically, in this particular case, I had used a B cartridge. There is a 3 mm, 0.6 joules, 250 lines on the face and neck, and the C cartridge, 0.8 joules, 80 lines. And I had also combined this with grid RF. So I could also achieve a tightening as well as the lifting effect. So this you can see from the forehead area, the effect that you can see, the pre-jowl area, see the quality textural change of the skin. If you also see the neck area, you would be able to appreciate it in a much better way, the amount of improvement that you see with radio frequency. So there are two things, again, we need to understand and to make understand to our patients, that we can actually have an immediate result as well as a delayed results. In the immediate results is a lot of, because of tissue edema, you see a lot of tightening process which actually goes down, and eventually once the secondary process takes over, then you see the more permanent tightening. Again, another very important patients, we used energy, and we had used a higher energy in this particular case. If you see this area, and the neck area, if you see the amount of tightening that happens after 2 months is marvelous. You can actually see some reduction of the fats. This particular patient had come with, she had done dieting and she had started to lose her fat from the face, and she wanted the tightening of this part. And believe me, she had come to me after 1 year, and the result is still maintained. Another patient with similar results, if you see the nasolabial fold area, this is improved. There's a tightening, the quality of the skin. Another patient with similar results. So we had also done it again for the jawline reshaping, with both B and C cartridge. So B was so this is basically these are the energies. So now, what are the benefits of HIFU treatments? Basically, it's non-surgical. There's no downtime. It has a proven ultrasound technology. It has a gradual results over 2 to 3 months. It is very convenient, 60 minutes procedure, and commonly just one treatment is enough, unless the patient has a lot of sagging, wherein you might need to repeat it after 1 or 2 months again. So basically, what are the cautions that we need to take care of? We have to take care of the nerves. We have to take care of in the mandibular area and the nasolabial area, and in the forehead area, there are some superficial nerves which you need to take care. And the treatment intervals we have already discussed. The aftercare is very important, to apply light cooling on the surface of the skin to prevent redness. You have to avoid steam and saunas and bathing for 1 week post-treatment. Avoid sun exposure, extra and excessive sun exposure. Use good sunscreens, and avoid all forms of facial for the next 1 week. What are the common side effects that we can see? We can see some amount of erythema and redness, which is minimal, clears in maximum 1 or 2 days. However, if you see stronger erythema persisting for about 15 to 30 minutes, you start icing and cooling the area. You can very rarely, the other side effect is muscle ache and stiffness of the chin area. It disappears in maximum 1 week. However, if high energy is used, it can last 1 or 2 weeks maximum. Nothing specific to be done for this particular thing. Burns and blister. Now, this is a very grave and very bad complication which you can develop. It happens if you use very high energy or the cartridge. Sometimes if it is not fully in contact with the skin, this can also happen. And you have to do cooling and apply cortisone creams and oral cortisone. So based on your judgment, you start treating the patient. So nerve damage ideally should not happen. If it happens, generally it is very mild. It recovers on its own in 2 to 3 months. You can start giving them some neurovitamins like B complex based and B12 based vitamins to help it to regenerate better and faster. So now let's come to the excuse me, comparison of RF versus the HIFU treatment. So RF basically causes a bulk heating of the area of the epidermis and the upper dermis, whereas the ultrasound causes a heating of the lower layers. It produces microfocal thermal zones, so the thermal coagulation profile is maintained and specific sites of the body. Now, important to compare it with the lasers, and lasers are basically very superficial. They produce sub-millimeter, 1 to 1.5 millimeter of specific coagulative zones of the skin. They have a very selective heating, and however, they are sub-millimeters, so there's no depth control. But at the same time, they can cause some various cutaneous side effects like excessive pigmentation or redness or excessive inflammation. Radiofrequency, on the other hand, are basically, they have a variable depth of penetration, varies from 2 to 3 millimeters. They produce volumetric heating, and there is non-selective. Ultracell on the, or high intensity focus ultrasound on the other hand, produces, we can have depth control. It produces focus ultrasound heating, and it has a consumable. In the next slide, again, we'll be discussing again one more modality, which is the temperature change. So in ablative lasers, the temperature can rise up to 100 degrees centigrade and can cause tissue evaporation, HIFU 60 to 70, which is optimal temperature for neocollagenesis and collagen denaturation. In radio frequency, it can reach up to 55 millimeters. So what is the difference? So ablative we have ruled out because of the superficial and because of high superficial energy distribution and higher downtime. So why do we combine radio frequency and HIFU? I normally combine in most of my patients. Why? Now, the reason being that first of all, in radio frequency, we are able to target the upper part of the skin. In high intensity focus ultrasound, I'm able to target the deeper parts of the skin. As we know, the sagging happens, we had discussed in the aging process, sagging happens because of the weakening of the SMAS layer, the connective tissue, and the retaining ligaments. So by the help of HIFU, I'm able to lift up the retaining ligament, the SMAS layer, because the coagulation zone that are formed there. So this is the deeper lifting which I can achieve with HIFU. With radio frequency, we can achieve the tightening effect and the lifting effect and the delayed effect of collagen remodeling and the ablation or the adipocytic denaturation that happens eventually. So radio frequency, as a matter of fact, it causes tightening and three-dimensional tightening, and high intensity focused ultrasound causes a lifting of the skin. So this is the basic concept why I normally prefer to combine both of them. So well, this is just a small test to demonstrate as to how does the high intensity focused ultrasound works. If we use a polyacrylamide gel and place it in the front of the transducer, this blue color is a polyacrylamide gel, and it is infiltrated with bovine serum albumin, which changes color when the temperature rises. So you can see when the temperature rises, when the fires are short, the temperature rises, there's a color indicator, it turns pinkish, and after, as the temperature rises, eventually the temperature drops back to normal. So just to demonstrate. And by the way, the albumin is sensitive to temperature of 60 degrees centigrade or above, so basically we're able to achieve the adequate temperature. Another important slide, we see the phantom that the gel, that the temperature of the gel or the bovine or the gel that we use phantom is 27 degrees centigrade. If you fire single shot, the temperature of single shot is 20 degrees centigrade. If you see the body temperature is 36.5 degrees centigrade. So if we combine, we see a temperature of about 60 degrees centigrade. So this is an adequate temperature which is essential for causing the coagulation of this SMAS layer and the retaining ligaments and everything. So thereby it can increase the regeneration process. So this is again a process. In the previous slides we had seen, in the previous animated video we had seen the transducers firing the shots into the skin. Now if we see this particular side, we see that it actually fires the shots within this 2 marks of the lines, and this is basically the same phantom, the gel, wherein you will be able to visualize how the fires are shot. So with every single shot, you can see about 9 to 10 shots that are being fired in a single line. And when we repeat multiple lines in this particular way, all over, you can see the shots here. You can see the shots being fired all over. So when we repeat these kind of lines all over the face, we are able to achieve the proper depth and adequate coverage of the full area where we are planning to treat the target. Now let's come to the combinations, various combinations that we can actually go ahead with. Now there's one program in which you can have, which is totally non-invasive and maximum lifting program, which has absolutely no downtime. So it totally depends on your patient's presentations and the patient's requirement, what do they want. So in patients who would like to have totally non-invasive methodology, we actually combine a grid RF and the high intensity focus ultrasound. As I had already discussed, so grid RF helps in the immediate tightening of the upper part of the skin, and high intensity focus ultrasound causes a lifting of the deeper compartments of the skin. So grid RF, you can customize 2 to 4 shots, Ultracel 200 lines, BOC cartridge. So you can either do both of them on the same day, or you can give them an interval of 1 week. I normally try to combine both of them in the same sitting. But if you are doing both of them on the same sitting, I normally do high intensity focus ultrasound first, and eventually I go for the grid RF technology. Why? Uh, there's a specific reason for this basically. So what happens is, if for example, if I do grid RF first, it will increase the blood circulation in the upper part of the dermis and the epidermis. If the blood circulation is increased, it can alter the impedance of the tissue, and thereby higher amount of energy can be actually transmitted to the deeper layer. It can cause some burns or other side effects. So it is better to go for HIFU first, because HIFU, the target is in the deeper layer, so it actually spares the upper part. So HIFU, I do HIFU first, maybe 4.5 mm or 3 mm depth, and then eventually we do the grid RF. Grid RF again is done in the continuous motion, and then with the sliding, the specific short motions. Now, if we are able to combine non-invasive and invasive, then we can do high intensity focus ultrasound first and microneedling radiofrequency eventually. In this particular methodology, again, you can either do it on the same day, or you can do microneedling radiofrequency after about 1 week of during the ultrasound. So we do the non-ablative one first, that is focus ultrasound, and maybe if your patient is comfortable, you can call them after 1 or 2 weeks and then do the microneedling radiofrequency, and eventually then you can wait for the results. And so counseling part is very important. So make sure that the expectations of the patient and our expectation actually match. So they should not expect some magical improvements immediately after the sitting, because the result that we see immediately after the sitting is actually short-lived, and is basically because of the edema. Now, how about combination of fillers and Botox with energy-based devices? Now, ideally, on the same day, fillers cannot be combined. So post fillers, ideally, there should be a gap of around 6 months to 1 year should be advisable before you go for the high intensity focus ultrasound treatment. Now, post Botox, it is advisable that you go for 6 months gap. So personally, I would prefer to do the energy-based treatment first and eventually go for other neuromodulators. So you can do HIFU and grid RF first, and after about 1 month, you can comfortably cover volume loss with fillers, or wrinkles can be treated with Botox. However, if you would like to wait for the filler thing, it would be ideal if you can wait for another 6 months, then it can also be planned as per your discretion. Now, combinations with PRP. Now, PRP and MNRF, I believe, they complement and supplement each other. So I very commonly combine PRP with microneedling radiofrequency. So I initially do PRP because in PRP I try to mix some amount of lignocaine also. It also gives an additional numbing effect other than the topical cream applications. So PRP also mobilizes the growth factors, and once we do the microneedling radiofrequency after that, that can also mobilize the growth factor. So I think they supplement each other, and I very commonly do it with some excellent results. With HIFU and the grid RF, because normally I do not prefer to do PRP in the same setting because there's too much of aggressive treatment for the patients. Grid RF causes a little bit of redness, and the initial setting, sometimes the patients, it might be too much for the patient to take in one go. So we normally space it out for about 2 weeks after that. However, even if you do PRP after grid HIFU, grid RF and HIFU after 2 weeks, it will still supplement the regeneration process. So friends, as we all understand that aging is a very continuous process, we must address the patient's concern and educate them about all the befitting, reasonable options that we have for anti-aging process. We have to choose the best suited plan and mutual agreement, and just make sure after we have to understand that aging has to be a very graceful affair. So I would like to conclude the session by a very wonderful thought which I had just learned yesterday from a webinar, that learning has to be seamless and teaching has to be selfless. So I hope I was able to share some of my experiences and some of the concepts of the basic devices basically with you. And you are most welcome to chat with me now, or you can actually email me your queries, so we can actually personally learn from each other and share our experiences basically. So thanks a lot for your patience listening. Thank you. So let me take a few questions here. What is the depth of open pores and chicken pox scars? Somebody has asked me. So open pores, my friend, actually they are not very deep. So you can say open pores can extend from about, they are sub-millimeter, 1 millimeter, maximum sub-millimeter these lesions are. Chickenpox scars, also someone has asked. So chickenpox scars, it again depends on how big they can be initial. If you start the treatment very early, you can actually not have almost nil scars. If the patient is, it depends on the virulence of the virus. If there is high virulence and then you have not taken any treatment, it can lead to deep scars. So it can range from 2 to 3 millimeters or 1 to 2 millimeters. It depends basically. So for both these kind of scars, as I have discussed, so we can actually go for microneedling radiofrequency that works wonderfully well in both indications per se. So another question is, what is the treatment protocol recommendation for a person with weight loss and has laxity and the fat in the submental area? So it's a very important question that you have placed here. So before we go for any patient who has got laxity of the skin or who has got any amount of fat, so I normally, first of all, I normally do not advise patients with fat, too much of fat on the body with any of this kind of treatment. So this treatment is not majorly indicated for treatment of fat, although radiofrequency has got some adipocytic uh, denaturing effect as well, but this is not the major effect that actually happens. So it is basically advisable for patients who have actually lost weight and they have pockets of fat collection which is mild to moderate in size. If they have majorly fat collection, then I think it is better to go for other devices like lipolytic treatment. You can go for lipolytic injections initially and then go for high intensity focused ultrasound or grid RF technologies. And if the patient has once the patient has adequately lost fat and we have investigated the patient, maybe then there's the right time to go for the treatment, because otherwise the patient will not get results and then you would be actually in a complex situation where you'll have to counsel more. Okay, so another question is, if you're combining microneedling RF and HIFU, then HIFU is a non-invasive therapy and become out of purpose. So basically, yeah, so this is a very important point that you have again. So microneedling RF, yes, we can control depth with microneedling RF, and yes, we can control the depth in high intensity focus ultrasound. But what is the depth we are treating at in microneedling RF, and what is the technology that we are using? So in microneedling RF, we are using only radio frequency, whereas in high intensity focus ultrasound, we are using ultrasound energy that is capable of causing more heat generation, more coagulative zone, and eventually more lifting of the area. As comparison to radio frequency, we are only able to induce new collagenesis. We are not able to achieve coagulation. So that is why the combination becomes important. So we just don't use bulk heating. We actually also need to cause some coagulation for the lifting process. So the answer to that is radio frequency will not be able to reach the SMAS layer, neither the fibrous layer, neither the retaining ligament layer. Second thing is HIFU we will not be able to cause that amount of tightening and the neocollagenesis that we'll be able to achieve with radio frequency. And that was the reason of combining both the technologies together, so we can have best of both the worlds together actually. And the best part is, so we know that we have two major devices available. One is for radio frequency tightening and one is for high intensity focus ultrasound. But both the devices are very costly, and if you combine both the devices, both the technologies in one particular patient, it will increase the cost exponentially for the patient as well as for yourself because of the consumables involved. So that is the advantage of this device, this particular device that I had actually started to use, because you can combine both the modalities with very reasonable. The device is very powerful and the consumable cost is reasonable. So you are able to combine both the devices and you are able to achieve the two different histological changes in the person as well as clinical by combining these two methods. So someone has asked, what is the problem in doing fillers post the HIFU and RF treatment on the same day? So either on the same day, so basically what happens is high intensity focus ultrasound produces some amount of heat, right? Radio frequency also produces some amount of heat. So if you are planning to put a filler on the same day, the amount of heat you might not be able to visualize the effect of the result. Second thing is, if you do radio frequency, there will be an immediate tightening and contraction of the tissue, and you will not be able to visualize where you have to put the fillers. So clinically, if you say, your judgment will be impaired, and otherwise also, if you see, because of the heat, your filler, the longevity of the filler might be hampered, and the effect that the filler gives might be hampered. You might either end up underfilling, and even if you fill adequately, it might dissolve very fast. So ideally, it is not a good idea to use filler on the same day along with the HIFU. So PRP helps in improving regeneration and decreases downtime. Should we combine in the same day? Yes, PRP should be combined. Yes, I totally agree with you. So PRP can be combined. I normally combine it with uh, uh, microneedling RF, which is very commonly I do in almost all of the patients. Now, PRP is actually is not a total contraindication. If you say if you want to combine it with grid RF or with the high intensity focused ultrasound, you can actually do it on the same day, and you can do it on 1 week interval also. It doesn't matter. However, if you're planning to do PRP on the same day, in case of radio frequency, it is ideally advisable to do PRP after you have done the radio frequency. The reason being, if you're doing PRP first, you're actually putting PRP into the dermis, you're putting a liquid into the dermis, and if there's a liquid into the dermis, then the energy distribution and the resistance and the impedance of the tissue might be hampered. So eventually, if you do radio frequency after that, you might be able to see some variable results. It can either transmit heavy energy, it might not be able to transmit energy. So the chances of side effects might increase. So ideally, it is advisable to do radio frequency first, wait for a week, and then go for PRP. So again, what is the level of MNRF you use? So level of MNRF again depends on the type of the indication primarily for which you are treating. So if you see, you have to judge this basically on your clinical judgment. But however, if I see deep scars, it is ideally good to combine 2 millimeters to generally 0.8 millimeters, because all the scars have got a superficial component as well. So I normally most commonly combine 2 millimeters along with 0.8 millimeters depth. Okay, another very important question is, how do you manage the lean phase? Okay, so this is again a very important question. So in lean phase, primarily what do we have? In lean phase, we can either have loss of volume or we can have a lot of sagging of the skin. So if this is the case scenario, then I would say I would still like to combine radio frequency and HIFU, but with the superficial probe, either 1.5 or 3 mm probe, because the result that you'll be able to achieve with this, you won't be able to achieve with either HIFU or RF alone. So what I will do is, first I will do high intensity focused ultrasound and radio frequency combination on the patient, initiate the collagen remodeling and the necrotic process, which induces the regeneration process. And maybe after about 1 to 1.5 months, then I'll start to look at the volume loss, where I'll be starting to fill it up with the fillers. So in this way, I would be able to treat the quality and texture of the skin and the retaining ligaments and the SMAS layer, as well as add volume to the face. So remember, fillers should be done after you have done HIFU. The more duration, the better. It should never be done before. So always energy-based devices, and then you go for the filler, and then the superficial treatments like peels and all those things. Okay, and so someone has asked me about which patient you will suggest only HIFU. So it's basically based on, so there are various variables that you have to take care of while you're suggesting the treatment to the patients. You have to suggest, first of all, you have to base everything on your clinical judgment. Then you have to very patiently listen to what does the patient want. What is the economic profile of the patient? So if the patient wants slow and gradual result, and he or she has amount of sagging of the skin, and doesn't have very high and immediate expectation, doesn't want fast immediate results, I would actually suggest in them HIFU. And there's more of the sagging of the skins with some amount of fat also in that HIFU. I would suggest them HIFU. However, even in such patients, I can combine it with the RF. If the patient, if both the patient and me come in line together, then I would always prefer to do a combination. So another question is, do you ever do any grid RF without HIFU in any patient if the patient cannot afford HIFU? Yes, definitely. We can definitely do HIFU. HIFU is a very important modality for skin tightening. Actually, if the patient does not have fat and just sagging of the skin, HIFU is the best modality. You can actually do one sitting once a month for about 3 sittings. You'll achieve excellent results. And mind you, the results are going to last for more than a year, average. However, the treatment has to be customized on every individual to individual basis. Okay. So someone has mentioned, there are also someone has also asked me about SSR tip. So SSR tip is basically a superficial epidermal for the superficial epidermal ablation. I normally combine it sometimes when I want a little bit of ablation and of the superficial part. And if there's some uneven complexion on the upper part of the skin and for fine lines, we normally do sometimes the SSR tip. This is another ablative, very minimally ablative tip, which is for the epidermal modification. Yes, I also do combine it at times. So, so someone has asked, in different skin types, people have claimed 3 passes of 5/6 power with microneedling radiofrequency with excellent results and better than CO2. Is it true in your experience? Well, yes, uh, first of all, I would like to tell you that initially before using this device, I used to do a lot of CO2, lot of erbium YAG lasers as well. CO2 gives excellent results. There's no doubt about it. However, there's also a problem with the downtime of the device. So at times, where sometimes patients do not have downtime, sometimes unexpected. So it's the results are very variable. You do not know where you can get the downtime. The results are definitely variable, but the only downside is it is sub-millimeter ablation that happens with the carbon dioxide laser. So MNRF definitely, if you do at a proper depth with the proper power, and if you do it in 1 or 2 to 3 variable depths, it gives very good results in 3 sittings without the side effect of downtime. However, if you use very high energy to the level of 6 or 7, a downtime is observed, which stays for 3 days, you can say. But that you can counsel your patient that after you have given 1 or 2 moderate sittings, you can actually give them 1 sitting. The downtime as such, however, is not as severe as we see in the carbon dioxide patients. Why? CO2 laser patients. Why? Because I particularly I have a preference for using a insulated needles. So what insulated needles do is they have a radio frequency at the end of the needle. So we can actually modulate where we are delivering the radio frequency. We can deliver it then at the end of 8 millimeters. We can deliver it at the end of 1.5 millimeters or at the end of 2 millimeters. So the ablation will happen in those areas. And if you even if you use high power, the superficial damage that happens is very minimal. And generally, I have seen generally 3 to sometimes in darker skin patients, 3 to 5 days it clears completely. Okay, any? Okay, so someone has asked a very important question. Any chances of laxicity while using HIFU in chubby phase? Okay, so that is also another very important question that we have placed here. Yes, there have been a few cases of laxicity of the skin when you are using HIFU in a chubby phase. Now, there can be various reasons attributed to that. I would like to discuss a study which was conducted which had shown that if you increase the energy, I would like to answer this with a study. So if you increase the energy or the heat that you transmit into the dermis to about, if you're able to give 60 degrees centigrade heat into the dermis and the subcutaneous tissue, sorry, it's about 42 degrees centigrade. If you're able to transmit the heat, you will be able to see delayed destruction of the adipocytes. However, if you are able to transmit about 45 to 50 degrees centigrade of heat into the tissue, you will be able to see immediate adipocytic denaturation. So if you give uh, so this is one concept. The second concept is the resistance. So the resistance can vary in different parts of the face, in different part of the face. So if any particular area there's a lot of resistance, you'll be able to transmit lesser energy. If any area where there's low resistance, you'll be able to transmit more energy. So there can be variable energy transmission to the area. So there can be variable loss of fat, which can happen in the areas. So a sagging can happen in certain areas where the adipocytes are killed. However, that sagging can eventually be taken care of by the macrophages in due course of time. So a very important clinical judgment that you have to make is, first is temperature monitoring. You have to monitor the surface temperature. So surface temperature of 40 will give you a temperature of about in the dermis about 55 to 60 degrees centigrade. Surface monitoring is important. And if you feel that at certain areas the fat is less, to reduce energy. visit certain areas fat is more, so increase the energy. Another important aspect to understand here is it is important to use lower energy more frequently rather than using higher energy in the same setting. So you can divide the same energy that you're giving in moderate energies in two sittings, always better than giving high energy in a single setting, because the chances of side effects will increase. You can even actually cause burns or blisters with high intensity focused ultrasound if you give very high energies. So it is very important that you space out your treatments. No need to give very high energy in a single sitting. Give one now, give one after 1 month, and modulate the energy as per the your clinical judgment and as per the tolerance of the patient. If the patient complains of severe pain, that means either you are hitting on a nerve or the energy is quite high. So it's basically you have to keep your eyes and ears open, because every patient is unique and we have to take care of every patient and make sure that we do not give any kind of side effect to any of the patients. Okay. So a very pertinent question to the current scenario. Someone has asked, patient who has recovered from COVID-19 infection wants HIFU and microneedling radiofrequency. How much time gap is needed? So very pertinent question, my friend. COVID-19 is an infection which is currently going on. So if a patient has just recovered from COVID-19 infection, I would advise him to take proper rest and recover from the illness, and let the scientists go into the details of the viral infection, so that we also find out if after proper treatment you are totally recovered. And once you're totally recovered after 3 to 4 months, then you start to go for anti-aging process, because recovery from COVID is very important rather than the treatment of hypo microneedling, because COVID at times can be life-threatening. So it is important that you take care of your general health first, and then I would advise him to go for hypo microneedling treatment. Someone is asked about the opinion about insulated and non-insulated needles, which are better. So okay, so let me tell you, friends, the difference between insulated and non-insulated needle. Insulated needles are the needles wherein the entire length of the needle which goes underneath the skin passes the radio frequency current. So, sorry, non-insulated. Non-insulated needles are the needles wherein the entire length of the needle will be passing the radio frequency all over the skin where it is penetrating. Insulated needles, on the other hand, will actually just have will actually pass the radio frequency only at the tip or at the end of the needle, right? So as such, if you see, non-insulated needles would be better because they would be transmitting the energy all through the length of the needle as compared to insulated. However, as per a few studies and the journals, uh, it was found that insulated needles were able to achieve better results because it was able to focus the energy at a single focal point rather than all of the focal points. So it was able to give much better results as compared to non-insulated needles. Not to speak of the fact that insulated needles also offered us better protection of the epidermal layer. So the downtime was very less in case of the insulated needles as compared to non-insulated needles, where the downtime was higher because of the ablation of the entire length of the needle. So it was also used to cause epidermal damage and thereby leading to crusting. So both the ways, insulated needles was better in having a lesser to no downtime and giving better clinical results. So how and where, someone has asked, do you mark the do not treat zones in HIFU? So do not treat zones are basically the zones of the area where you have superficial nerves or important structures, like exactly in front of the thyroid cartilage, thyroid and the tracheal area. We normally do not, because the superficial location of the thyroid gland. We normally don't do it in the mandibular area and on the prejowl areas, and normally on the upper forehead area where the supratrochlear and supraorbital nerves are there. So ideally, these areas are ideally, preferably, a no-go zones. Now, how long does the laxicity last if it happens? How do we correct it? Is it correctable? Can we use RF if we get laxicity? Luckily, I have less experience, my friend, of the laxicity part per se, because I try to be very cautious in using moderate energy. So the answer to this question would be why the laxicity has happened. So the reasons can be, number one, laxity can be either because of damage to the motor nerve of that area. Now, if the laxity is because of damage to the motor nerve of the area, the damage luckily is not a permanent damage. the damage recovers in about 2 to 3 months time, and once the damage recovers, the laxity should go. In the meanwhile, it is ideally advisable to give them multivitamins, especially B12 based multivitamins. It is also advisable for them to go with physiotherapy exercises of the face so that the nerve regenerates faster. So might need to involve a physiotherapist as well as a neurophysician to be on the safer side. Secondly, if the laxity happens because of excess dissolution of the fat on that area, it again is going to take 2 to 3 months because that excess fat will actually takes its own time for it to get absorbed eventually. Thirdly, if the laxity is too severe, don't hesitate to take the help of your plastic surgeon colleagues who are specialized in uh, more invasive procedures. So always discuss with your friends and let them know so and so thing has happened, and advise free consultations to the patients. Go with your friends with the patient, discuss the chances of any permanent damage, or permanent damage it has hardly ever happened. So the ideal idea is to counsel the patients and wait for 2 3 months. Generally most of the laxity improves on its own, and next time always be careful of the energy that you're using, of not using the device in certain areas, and above all, most important, try to use uh, good devices which have some FDA approvals of. So try not to go for devices wherein the energy distribution or the delivery of the energy is not adequate. So this also happens when the device is not of adequate standards and it delivers variable amount of energy in variable areas. So make sure you also have a look at the device that you're treating with, and try to know God not try to not to go with that particular device which had actually caused the problem. So someone is asked to see the slides of the parameters. So you can actually this video will be available in YouTube, and you can actually see all the parameters from there. Also, in the current context, I was not able to show you the live videos of the treatment. So if in case any of your friends want me, so in the next section, I'll always make live videos from beginning till the end, the complete parameters and everything, how does the machine works, we play with the parameters of the device, and we can actually you can actually visually be able to see more results happening there. I mean, if in case you want, you can always let me know in the chat section or in the, or you can email me so that we can actually go through the detailed videos eventually. So someone has asked if the patient has done a thread, any contraindication. Well, if the patient has done threads, ideally there's not an immediate contraindication, but it's a relative contraindication. So ideally it's not a, because the effect of thread will actually wean off very fast. So it's not a, ideally, although after the procedure you can actually do threads, but post threads, again, something like fillers, it will tend to dissolve faster, and the effect of threads might reduce eventually. So always remember, try and use energy based treatments first, then you go for other treatments like thread lifts or PDO lifts or fillers or neuromodulators, and then you go for the treatment of the superficial part of the skin, which could be either Q-switch laser or chemical peels or topical applications and everything. So it was found that with non-insulated needles, the bleeding will be less as compared to insulated needles, your inputs. Yes, actually, this is a fact, because if you use non-insulated needles, the bleeding will definitely less because it will immediately coagulating the areas also. Yes, that is a fact, my friend. So that is definitely true. But we should not be scared of seeing a little bit of blood on the face while we're treating, because the end result that we have to give to the patients, and one we will be facing the patients after a month's time. So the patient will ask me, uh, what is the result that I am seeing? So I have to take pictures and I should be able to show them some results. So based on the efficacy wise, I found that insulated was found to be better, and there was no downtime. So I was able to give them low downtime and better results. So that was my personal experience. However, some people might have found good results with non-insulated as well. I personally have less experience with that, and as for the studies also which we have gone through, it was found that insulated was considerably better. However, if someone is comfortable with non-insulated, a lot of my friends are also do use some non-insulated tips as well. So that can also be used. It's basically your call and your clinical judgment. Uh, So someone has asked the question, in which areas of the face 1.5, 3 and 4.5 cartridges are used, and can various cartridges be used in combination in the same treatment? Okay, so I think I've already discussed these segments in my slides very effectively. The various areas where the different kinds of cartridges can be used. Uh, so those areas are just indicative areas. It's basically your clinical judgment. Where you see more fat, especially in the cheek area, you can use 4.5 mm. Where you can use moderate fat, you can use 3 mm, and you can use 1.5 in thin areas. 1.5 areas is cartilage used in thin areas like in the forehead areas, periorbital area. However, if you ask me personally, I normally go for only 4.5 and 3 mm cartilage. I don't use the 1.5 mm cartilage. Why? Why? Because I have got radio frequency. In the areas where there is thin skin, especially in the forehead and the periorbital areas, I always go for radio frequency tightening because the device has the radio frequency as well. And for other areas, cheeks, jowls, submental fat, I go for 4.5 and 3. Sometimes I also do 3 millimeter on the neck area where the skin is thick and we see lines around the neck area. So 3 mm followed by followed by grid RF works wonderfully well in these areas. So someone has asked, what is your experience with treating under eye fine lines and sagging? So for under eye fine lines, among the modalities that I've discussed just today, what gives a very good result is basically grid RF with the 7x7 millimeter probe. So grid RF is basically radio frequency, which causes again regeneration of the collagen in the area. You can see an immediate lightening effect, and you can see a delayed tightening effect. So 3 sittings of the device placed 3 weeks to 4 weeks apart will give you at least 30 to 60% improvement. That varies on individual to individual per se. Sagging, if there is basically skin sagging, it improves by about 50 to 80%. However, if the sagging is mainly because of the fat compartment in that area, the result in sagging can be marginal. It can be about 20-30%. We don't expect more than that. So if you have majorly skin sagging, you can safely assure them for about 50 to 80% improvement. However, it might not be a very good idea to use completely for the fatty area, wherein you might need to, if the patient wants some radical improvement, you might need to refer them to some plastic or some ablative or liposuction procedures might actually be more helpful, or blepharoplasty might be more helpful in those kind of cases. So they're helpful in mild to moderate cases of skin sagging, not majorly fat in those areas. So I think we are done with the questions part. So if I don't see any more questions coming up. So if you have any more questions, you can actually connect me to the my email and let me know for any such queries. So I think we can call it off then. I think so. All of you be safe and be healthy. Stay indoors currently in the period of lockdown, and take care of your and family members. And most welcome for any further queries. Take care. Thank you.